When service members transition from military to civilian life, they of course still need health care, even though they're no part of the military health system, and they need care that takes their veteran status into account. We're here with Shannon Davila, Executive Director of Total System Safety here at ECRI, to talk about a new program we're launching to support veterans' health. Shannon, what are some scenarios where veterans might find themselves at a different kind of risk than a civilian?
Thanks, Paul. So I think the best way to answer that question is for me to share the example of Jackie. And in the white paper that we are releasing, we talk about Jackie, who is a 39-year-old woman. Jackie recently moved to a new town, and like many of us, when we move to a new town, we make an appointment to see our new provider. Now, Jackie went and she saw her provider, and the provider asked her about the usual things: her past medical history, her family history, what kind of medications that she takes. And the appointment went pretty well. There was nothing, that stood out to the provider. Jackie's only 39, so there were no follow-up tests needed. And the provider, basically ended the appointment by saying, hey, just schedule your next year checkup and we'll talk to you then. Unfortunately, what that provider did not know was that Jackie had served in the Army, and Jackie had been deployed to Afghanistan. And when Jackie was there, her job was that she was a mechanic, and she worked in an open-air hangar that was downwind from one of the base's burn pits. And a burn pit is a large hole in the ground in which military facilities, generally overseas, burn pretty much everything that you can imagine: equipment, oil, diesel, medical waste, and it creates really toxic fumes, similar to the fumes that our 9/11 first responders experienced when the Twin Towers collapsed. So the provider, though, did not know any of that history about Jackie, and unfortunately, this represents an opportunity for an improvement. Now, if that provider had known that Jackie had served in the Army, they could have asked questions. They could have asked questions about Jackie's mental health state. They could have asked questions about Jackie's physical health state, including what types of exposures to toxic chemicals did she have. Women that serve also have higher rates of depression and PTSD. A lot of women that serve have experienced or witnessed military sexual trauma. So all of these issues represent risks that men and women that serve in the military that have, and so it's really important for all healthcare providers to understand these risks, and that's a big part of our Salute program.
Shannon, unlike me, you're a veteran yourself. How have you seen that sort of difference between veteran care and civilian care? How have you seen that play out in your own life?
Mm-hmm. So I'll tell you, so I served in the Air Force over 20 years ago, and since I have been out of the Air Force, I've sought my care through civilian health care. I've been fortunate enough that I did not have any service-related health disabilities, so I did not need to seek my care at the VA. I've also been fortunate to have employer-sponsored health insurance. Now, in the 20 years that I've been out, I have not once ever had a healthcare provider ask me anything about my veteran history. I've never had anyone ask me if I was exposed to anything that caused me to have post-traumatic stress disorder. I've never had anyone ask me if I served overseas, was exposed to burn pits. I've never had anyone ask me if I was sexually assaulted or sexually harassed. So for me, this is personal, and when I talk to other veterans in similar situations of myself, this is not an uncommon story. And many have told me that they also have never been asked by their healthcare providers about anything about their military background or the mental or physical injuries that they incurred. And this really represents a disparity in how veterans are treated in healthcare. It represents opportunities to improve the equity of care that veterans receive. And I'm not talking about just within the VA health system, but in our civilian provider community. There's about 20 million veterans right now in the United States, and 10 million of us do not seek our care within the VA health system. So that's a huge amount of individuals that are walking into provider practices every single day with information that they could share that could help that provider make better diagnostic choices, and really improve the care of those veterans.
Yeah, I mean, I think there might be a myth or a misconception that, well, oh, this is a veteran safety issue, therefore it's a VA issue. But I think there's really, I mean, that number you shared just sort of gives the lie to that it really is every PCP has to be aware of this.
Yeah, absolutely. And there's a lot of studies and data out there that shows that within the civilian healthcare provider community, there is a lack of what we call military cultural competency. And military cultural competency is knowing what are the customs from the military, but also what is that military mindset that veterans have. And also understanding what are some of those service-related health risks that we just talked about, mental health risks, physical health risks, emotional trauma, PTSD. There's so many different health risks that our civilian and other providers are just unaware of.
You mentioned earlier, Shannon, ECRI's new Salute program. Can you tell us a little bit more about what that is?
Absolutely. So the Salute program is part of our Total Systems Safety Initiative. It's really a key component of a safety management program, and it's all about partnering patients with providers to improve safety. And Salute focuses on veteran patients. It is an evidence-based collaborative opportunity for learning. It's going to be free. It's really open to providers in the United States and Canada. It's a worldwide program. And it's a framework to help bring patients that are veterans and healthcare providers together to, number one, better understand those service-related health risks that veterans have, and also to improve that military cultural competency of healthcare providers. The two tools that are the primary focus of Salute are derived from the ARC toolkit for engaging patients to improve diagnostic safety. There are two tools. One of the tools is called the Be the Expert on You form, which is a veteran-facing tool. And it's meant to be put in the hands of veterans before their provider encounter. It helps prepare that veteran to think about their background, their history, their physical and emotional health. It prompts them to think about any issues that they may have experienced during their transition from active duty to civilian life. The other tool is the 60 Seconds to Improve Listening for Diagnostic Safety tool. And this is a provider-facing tool. And this is really an educational program to help healthcare providers to better actively listen when they are in that encounter with that veteran. And it helps them to understand the service-related health risks that I talked about. It also helps to connect healthcare providers to veteran-related resources so that after that visit, the healthcare provider can really help that veteran understand what resources are available to them. Are they, eligible for veteran health benefits, and also potential, subsequent diagnostic testing and further discussions around the issues.
I mean, you touched on this earlier, and it seems like it's relevant to what you're describing now, but how important is just that first question of just knowing whether your patient is a veteran or not?
So, just go back to Jackie's story, right? If that provider had just simply asked Jackie, have you served? That is the key to opening all of this information, and it will take that provider and that veteran down a pathway to more holistic health care that's more equitable, and at the end of the day will just improve the outcomes for the veterans.
I think of it as being so analogous to that, have you been pregnant in the last year, right? Which is providing that postpartum care. It's just these basic things we need to know about patients to meet them where they are and provide the appropriate care.
Absolutely. And the goal of our Salute program is to normalize this so that we're taking away stigma that many healthcare providers may feel that it's not their right or their place to ask about veteran health status. But we want them to know that this is an important issue, and we're going to give them the tools so that they're able to have those conversations.
Shannon, if folks are interested in learning more about our Salute program, how can they do that?
Absolutely. Well, they can start by emailing at salute@ecri.org to find out more information. And as part of the Salute program, providers are encouraged to join our Salute Honor Roll, which will enable them to have all the tools of the program and also join a collaborative learning system to network and to share with other providers that are involved with Salute.
That's great. Great, Shannon. Thanks so much for joining us today.
Thank you.
Thanks for watching ECRI Now. You can find more insights from the experts on YouTube and at ECRI.org. Until next time, I've been your host, Paul Anderson.